All right. Well, welcome, Dr. Andrew Harmon, first year psychiatry resident alongside with us. I don't think we've interviewed any interns yet, right?
First one.
Your first one?
First intern.
I mean, probably the best one. So that's a good.
Well, thanks for doing us the honor. We appreciate that.
And I do what I can here.
Right. And so tonight we're going to be talking about Johnny Manziel. I think everyone knows who Johnny Manziel is, and specifically we wanted to talk to you about Johnny Manziel because I know you have like a football background. I don't know if you played in college or whatever, or I'm just kind of this story hits really close to home for me because he does disclose that he has bipolar disorder. But I kind of wanted to have this episode because of the Netflix documentary, Untold, Johnny Football, that just released, I don't know, a couple weeks ago or whenever we end up releasing this podcast. And I must say, I'm very curious. I want to start off with this. I was a little disappointed in how little he actually talked about his bipolar disorder. Let's start it out there.
I
it
would
was just
agree.
like a footnote at the end. Hold on. Before we continue,
Yes.
just a quick note. Dr. Andrew Harmon, very relevant for this discussion because you have a football background.
Correct. Yeah.
And we have Dr. Logan Noone here, also very relevant to this conversation because you are a physician living with bipolar disorder.
Oh, okay.
Yeah, I got everything here.
Yeah.
All right.
Why are you even here, June?
What do you
Moral support?
Just here to cheer us on?
I have nothing of importance to contribute to this episode. I don't play football. I don't have bipolar disorder. But I think there's still some points that was mentioned in this documentary, especially with like substances. And maybe that's something that I can shed a little bit of professional light on. So, Andrew, what was your overall takeaway? I mean, obviously, this was more a movie or documentary rather, about football rather than bipolar. Because like you said, Logan,
absolutely.
it was pretty much like a footnote at the end. I have that quote by Johnny Manziel. In the last 5 or 10 minutes, he said, quotes, "I got diagnosed as bipolar, and I felt like it was the same as being called an alcoholic or a drug addict." So I actually want to pose this question to you, Logan. As somebody living with bipolar disorder, how do you feel about that second half of the statement? And it felt like it was being called, and I felt like it was the same as being called an alcoholic or a drug addict.
Yeah. You know what it makes me think of? I was diagnosed in 2011 at the age of 22. And I remember, I definitely didn't have the same attitude towards disclosure that I have today. It's kind of evolved. And what I first started telling people was actually that I had an issue with substances. Because for some reason, that was actually easier for me to disclose than bipolar disorder. I would just be like, I was going through a tough time in my life, and I just kind of shut up there. Because there's just so much that scary word that we all kind of hear, like stigma around bipolar disorder, like thinking you're crazy. When somehow this like addict lifestyle or something, even though that wasn't something that I was necessarily living, that wasn't really something relevant to my past the same way Johnny Manziel, but it was almost like easier and more well accepted amongst friends or new people that I met, which, I mean, I guess I could relate to him in this discussion. I almost wonder, I had a lot of kind of thoughts about this, but I'm definitely biased, right? I was looking forward to this documentary so much because I knew that he had been diagnosed with bipolar disorder. So I was really hoping that the vast majority of it would be how bipolar disorder related to his perhaps successes and failures. And, after watching it, it's like, oh, wow, it's like it seemed like only a few minutes. It did, of course, touch on other mental health subjects, substance use, suicidal thoughts.
When did he disclose that he has bipolar disorder? Did you know that before watching this documentary?
I did, yeah. I mean, I've seen interviews of him on various, news outlets and all that stuff. I feel like I've been very tuned into bipolar disorder news for years and which celebrities have bipolar disorder. I feel like I could rant them off as if I somehow am connected with them in this with this totally weird BS. But I'll stop rambling now. But I mean, what was your takeaway, I guess, then immediately after watching this documentary?
Well, so the thing as psychiatrists, right, we can't diagnose somebody with bipolar disorder without doing the evaluation ourselves, right? Agreed, right? We're all doctors here. Yeah. So there's elements of, his bipolar diagnosis where I definitely had some questions, right? I'm not trying to question the veracity of that bipolar disorder diagnosis, but just drawing from my own experiences, I feel like, so simply put, if you show up to the emergency department and you're consistently using drugs, you use enough drugs, you come to the hospital enough, you're going to pick up a diagnosis of bipolar disorder. And I say that because substance use disorders can mimic some of the symptoms that we see in a bipolar disorder patient. So, for example, the insomnia that's associated with bipolar disorder, right? That could be substance induced. Some of the mood instability and the affective instability that you experience as well, right? That can also be attributed with substance use disorders as well. And there's elements of, like some of his spending sprees, right?
Yeah.
I think if there's one thing that stood out to me is, maybe, because he was spending excessive amounts of money, maybe that's one of the big criteria that was used to diagnose somebody like this with bipolar disorder. But I also asked myself, like, is that a symptom of mental illness, or can it possibly attribute it with somebody who grew up in, as far as I know, it seems like he came from a pretty middle-class background and he achieved this level of fame that he did not expect. And all of a sudden he has millions and millions of dollars and he's a 19, 20-year-old kid at this point. So to a certain degree, I kind of wonder, like, isn't that something that maybe expected to a certain degree in somebody who finds themselves in this kind of circumstance? And again, like, you can't really assess the validity of whether somebody has bipolar disorder or not unless you do the full evaluation yourself. So a lot of this talk, a lot of this episode is kind of going to be speculation to a certain degree, but we're hoping that we can kind of use some of the symptoms that Johnny Manziel displayed and some of the patterns that we see, and knowing that he's somebody that lives with a diagnosis of bipolar disorder right now, hopefully provide some educational commentary as far as what exactly bipolar disorder is.
Yeah, honestly, I had a lot of similar feelings to you, Joon, watching that, where he kind of just like drops it in like, hey, I have bipolar in this like last couple minutes of the documentary. But with like, it seemed like he was started doing drugs, like definitely heavily drinking in like high school, became like a high school phenom in Texas, I believe, right, where he grew up.
Right.
Which is like probably like the biggest state for high school football, where they treat it like their lives. So I do think, like, how can you possibly like even like diagnose him with something or evaluate him accurately where he's just been drinking and doing drugs for like years? Like, in the documentary, he says that he was partying with like all these celebrities, right? And being a high schooler, like early college kid, and you're going out to like clubs with people, like doing drugs like pretty frequently. And like Joon kind of detailed with all the symptoms that drugs can kind of come, I'm trying to think of the right word here, but they could present with after doing like these drugs, like doing like PCP or something, and more aggressive, cocaine, not sleeping. If he's doing all these things while he's being evaluated by psychiatrists, like how could they possibly differentiate it between the bipolar versus like substance induced?
Sounds like you're skeptical.
A little bit, yeah. Like, we see people in the ED all the time who come in and been doing drugs for however long, and we're just like substance induced versus like bipolar.
Right. Well, Logan, let me ask you this. What do you think is the ethics of doubting somebody's mental health diagnosis?
I was actually about to question the both of you. It's because it's like,
I'm glad I asked you first, because that's a hard question.
It's like, why is it relevant if you guys agree or disagree with the diagnosis? Quite frankly, I could really care less. Because another thing, that I actually think we could say with certainty is, what about chronic traumatic encephalopathy? Football players, I don't have the stats in front of me, but isn't it like a vast majority of football players, even from high school level football, live with some level of chronic traumatic encephalopathy, right? This is someone who played football year round if it's this high caliber of an athlete. And although he was a tremendous football player, he did take a significant amount of hits, right? Like we all did. I even think about maybe my prior sports background, although it wasn't football, did that contribute? Did some of my concussions possibly contribute to me having a manic episode at the age of 22? It's like, can't say it did, can't say it didn't. It's impossible. But I think it's a complete waste of breath whether to rule in or rule out bipolar disorder. Whereas in reality, I truly just care about what is this person's human experience, right? Like, do they have racing thoughts? Do they go through these surges of energy? That's how I like to colloquially describe my bipolar disorder. And I see that also in my patients too, of this surge of energy that goes up and it also crashes down. It can go into grandiosity as well as like anxiety, irritability, and of course, deep holes of depression. So for me, whether it's induced by substances, chronic traumatic encephalopathy, or is it like the genetic whatever that leads to bipolar disorder, I think none of it truly matters, because what I think was most relevant to this documentary is like, you know, it seems like the favorite, I want to say American, but almost like worldwide, like story of this tremendous character who climbs up this mountain and then you see this crash in front of your eyes. And I hope that, you know, there is another Johnny Manziel documentary a decade or two from now, because I look at an individual like that, how tremendous of a coach could this individual be for these athletes that we see now that are very well falling in similar lines of Johnny Manziel, right? Like maybe they won't win the Heisman Trophy in their freshman year of college football, but hey, I'm a 76ers fan. I think a lot about Ben Simmons, right? What if Johnny Manziel could be some kind of teacher and be like, look, man, you are still in the maybe, I like to think, peak of your career. Like, could you turn this around? That's kind of what I think about a lot, what you guys were kind of talking about here.
I actually find it very interesting, your perspective on this, Logan, because you are somebody that lives with bipolar disorder. I would assume that to you, getting the diagnosis of bipolar disorder is of utmost importance, right? To a certain degree, isn't it a big part of who you are? Isn't it something that impacts your day-to-day life? So explain to me why you feel like it doesn't really matter whether or not, clinicians make an accurate diagnosis of bipolar disorder.
Well, I mean, because there's no way to 100% say with certainty that I have bipolar disorder. You know, I think that maybe we could agree that experience that I went through for that 5 days during when I was a 22-year-old could be a manic episode. Could it be a acute stress disorder and that had psychotic features? You know, I had just gone through a very tough breakup with, kind of like my first serious relationship. Was it some kind of, brief psychotic disorder, adjustment disorder? Who's really to say? You know, like, are there elements of my past after that initial manic episode that maybe are more aligned with bipolar disorder type 2, you know, this bipolar disease we think of as on such a spectrum. So that's kind of what I think about. And I think what all of this comes down to, in a sense, is, you know, look, I still consistently take medicine, but there isn't a night that goes by that I think about, like, why do I still need this, right? I'm liking that I'm being filmed from the kind of chest up here. I've never in my life had abs, right? And I've always kind of had this husky, built by Pillsbury body. You know, it's like sort of, you know, moderately athletic, but not like all the way there. So, I mean, I take that valproic extended release, right? Like, what's the most common side effect of that? You get fat, you know? And then I think about the alternatives in my life, like, okay, I guess I could try aripiprazole. I guess I could try Seroquel. All of those have the possible side effects of gaining weight, right? And it's not just about weight. I shouldn't say that, but, you know, that's what I think frustrates me, but also excites me so much about the world of psychiatry, because I think when people say anything with pure certainty here, I just laugh to myself. You know, I'll tell another quick story. I actually said this over the weekend at APA. I was like, isn't like an objective diagnosis in the world of psychiatry kind of an oxymoron? And I was sitting next to these other psychiatrists that, look, I think they take a more biomedical approach to psychiatric disorders. It is this, it meets criteria, therefore it is definitely X. And I get that. But, you know, I think a lot about, like, what are the psychosocial components that led to Johnny Manziel having this experience, right? Like, I try to describe bipolar disorder. One of my friends said, like, you know, when I got into medical school, she was a colleague of mine at medical school. When I got into medical school, I almost felt manic for like a few days. Like it was such a tremendous thing. I had been dreaming about this, but she's like, I couldn't sleep. I remember I was so social and like I had all this like excess energy because I was just so excessively happy. Do you remember, have you guys had any experience like that? Or I guess maybe when you got into medical school or maybe achieved a psychiatry residency? What do you think?
Yeah, I mean, I wouldn't say it lasted for a couple days, but for like the couple hours finding out, like got into medical school, got a psychiatry residency spot, I was like definitely very excited, like elevated mood, like almost like not able to contain the excitement. Mm-hmm. I mean, I wouldn't say like I'm not an overly excited person to begin with, so it didn't last like a couple days. Like I was able to sleep fine that night, but I could definitely understand like kind of someone describing that, which I think is why the context matters of when you, like, if you see someone like in the hospital, like someone described that, be like, oh, it sounds like you were just like really happy about something for a couple of days versus someone who like maybe like went through like a breakup or something and kind of went through a more traumatic, negative kind of situation. But yeah, no, I think it's really interesting that you brought up with not really mattering about the bipolar diagnosis, like especially for Johnny Manziel, like everything that he went through, regardless if it was drug induced or bipolar, like he still like went through that, still like an issue that he has had that led to him trying to kill himself. So like for the diagnosis doesn't necessarily matter in terms of that. It's more for, I think, the treatment going forward for him, if it is like a true bipolar, getting him on kind of the medications that he needs to prevent future events, versus if it's substance induced, be like, gotta stay away from the substances. Right. It could clear up a little bit.
One thing that I also thought a lot about, you know, maybe is the experience of being this like Captain America superhero athlete. You know, what is it like to throw a winning touchdown in a crowd of 80,000 people on a game that's televised nationally? You know, like Johnny Manziel arguably changed college football, and they talked about like the millions of ticket sales that he made. And of course it led to all these investigations, and that was a big part of the documentary. But could all of those tremendous experiences, those euphoria, like think about all the dopamine that's released in your brain, all of a sudden when you score that winning touchdown, you know, you're the man, everyone loves you. Could all of the plethora of that contribute to then the result of bipolar disorder, that you're chasing that kind of like, because I imagine after scoring a winning touchdown like that, it has to feel somewhat similar to a manic episode, right? Like, I mean, I don't know. Like I think I've had a manic episode, right? But I don't know if someone else's manic episode was exactly like mine, right? And I, of course, like I said before, built by, you know, Dunkin' Donuts growing up. No six pack here. But I did play in a high school soccer game one time that was extremely memorable, and there was at least a significant crowd there, maybe 100, maybe 200 people. And I had a really good game as goalie, and we ended up winning against our rivals. And like the next day at school, you know, people were congratulating me, and it was this whole thing. And like, it kind of had me thinking a lot about how, you know, could that experience somewhat mimicked a manic episode, at least for, not to the level of disorder, but for those few hours, for maybe those few days. What was Johnny Manziel's experience like when you're on top of the world of one of the most popular sports in the world?
Andrew, I'm interested in hearing your take because, I mean, you have a college football background, right? So what have been some of like the big games that you played in where you dominated your opposition, and how does that make somebody feel? Just being in that kind of atmosphere, the fanfare, and just the popularity that we commonly associate with being a star athlete.
Yeah, you know, it's definitely euphoric when you have that. Like I remember in like high school, I forget what team we were playing, but like had like the game-winning touchdown, like back and forth offensive game, got like interviewed and like was on like the local news or whatever for it. And it does definitely feel euphoric. I think it is pretty similar to kind of like a manic episode, at least for a brief period. It's not going to extend days. You're not going to stay up because of it, but there's like feelings of that elevated mood, like not being able to kind of contain those emotions is definitely something that I could at least relate on a small scale to someone who's kind of dealing with that manic episode, those elevated moods. And going to your point, Logan, with the Johnny Manziel playing in front of like tens of thousands of people. And this was like an extended period of time. Like it was like every week, like this like crazy, like
highlight reel.
like underdog kid, like doing insane things, especially when he went to Texas A&M and he's like beating like all these like schools and stuff. And this program that before that like wasn't like a big school. It wasn't like Alabama big or something like that. So yeah, no, I could definitely understand that. And I wonder, I was actually thinking about kind of like personality disorders with Johnny Manziel, and like obviously he has like some narcissistic traits. And I was thinking, I wonder if all that fame and kind of everyone just kind of bowing down to him, doing like letting him do whatever he wanted, if that like contributed to like him developing a personality disorder, right? Because it seemed like in high school he was pretty humble. He went to like a semi-military high school, right? Like everyone falls in line, and he goes off to college, and within like 1 year he's just like doing like whatever he wants, like just showing up to practice like hungover, things like that. And like I was just thinking, I wonder if people are more susceptible to it, or like they just grow up like almost like predetermined to have that, or if it's all these kind of things contributing where like everyone's just like praising you as a god, letting you do whatever you want, all this money as like a freshman year like college kid. I remember freshman year of college, like I had no money. Went to Europe with my friend, like backpack, and I came back with like $100 in my bank account. Like I can't imagine having like people just hand me like hundreds of thousands of dollars. And like, especially they look at, I have a sister who's 17, and looking at like her friends, like I imagine if most of them started being treated like they were better than everyone else in the world and handed all this money, that they probably would also develop some type of like narcissistic tendencies at the bare minimum. So
yeah, this is somebody that, you know, admittedly, like he said it himself, right? If he got to play college football, he would have considered that incredible achievement at a point in his life. So this degree of success is something that he did not expect or necessarily pictured happening to him. So I think to a certain degree, you know, that wave of fame just kind of swept him off his feet. And I mean, it might happen to any one of us, right? This is not to cast judgment on his character. It's just like none of us have ever been in a situation like that. So I don't think it's fair for anybody to kind of sit on the, kind of play Monday morning armchair quarterback and say like, oh, if that was me, that would never happen. I think, that kind of mentality in itself has a certain degree of hubris associated with it. Like you never know. Right, we're all capable of messing up. We're all capable of failing, and we just don't know because most of us, we're unfortunately making safe choices where we're not taking risks. So we never know, potential for failure that we have within us. And I can rant about that for hours, right? Failure in itself is never a bad thing. It's if you look at it in the kind of glass half full perspective, it's what propels you to future greatness. You build on your failures so that you can achieve great things later on. And Andrew, when you mentioned like narcissistic personality disorder, I was actually thinking the very same thing because at least from the outside looking in, narcissistic personality disorder was something that we always see. This is somebody who's, thinks they're on top of the world, who thinks, everything needs to be catered to them. And you can imagine logically that somebody in Johnny Manziel's situation where you're getting that much level of fanfare, everything's catered to you. I mean, that really is reality. Yeah. And you live in that reality long enough, you kind of get this perception that you are in fact this person. And that is 100% fact. And what is it when people, with that sort of perception towards themselves kind of get knocked off their pedestal, right? They feel like their core sense of self has been essentially shattered, and it can lead to profound depression. Suicidal ideations are very common. So like the typical example that's given in our textbooks is like that surgeon who's on top of the world, kind of like Dr. Strange, right? He's the bomb, and then one day he loses his ability to perform surgeries, and a big part of his identity has just been taken from him overnight. And he no longer feels grounded in knowing who he is. And that can lead to depression, suicidal ideation. So I wonder, like, is that a symptom of bipolar depression, or is that a symptom of maybe some sort of narcissistic tendencies, right? We're just outside looking in, speculating. We don't really know. But interestingly enough, another thing that I thought about immediately when he started to describe his depression, and I'm going to give you guys a quote about his depression, right? So if you guys remember in that documentary, the moment he started feeling depressed was actually when he got drafted to the Cleveland Browns.
Yeah.
He was a first round pick. And this was everything that he was working towards. And he just, essentially, if you're a first round pick, you get signed for millions and millions of dollars. So somebody like him coming from a small town in Texas, middle class background, right? This is a incredible accomplishment. And you, outside looking in, you'd expect somebody who achieves that level of attainment to be on top of the world, to feel incredible. And this is what he said. All right, quotes. I had everything I ever wanted. I had money. I had fame. First round draft pick. When I got everything I wanted, I think I was the most empty I've ever felt inside. And that kind of got me thinking about, you guys know that story about Michael Phelps?
Yeah, I mean, I guess just like how he was depressed throughout his entire pursuit. It sounded like I watched that documentary of him. What was it called, 6 Gold, or I can't recall.
So something very common, right? You're working towards this goal, like for Olympic athlete like Michael Phelps. It's every 4 years you're competing, and in 2006, after winning 6 gold medals and 2 bronze medals at Athens Olympics, Michael Phelps said he felt post-Olympic depression for the first time, and this is what he said. You work so hard for 4 years to get to that point, and then it's like you're at the top of the mountain. You're like, what the hell am I supposed to do? Where am I supposed to go? Where am I? So you just kind of lose that sense of purpose, right? And I think that's so important for a lot of people, especially when we talk about mental health, that purpose-driven life. And not even in the religious sense, right? You have to have a goal that you're working towards every single day. Otherwise, what the hell is the point really, right? To just simply exist. I think we all as human beings have this innate desire to want to achieve something that's bigger than ourselves. So for example, to be of importance to our communities, to affect other people in a positive manner, right? So these are some noble goals that you're working towards. But unfortunately today, I think especially, for a lot of youth today, we're losing, they're starting to lose more and more sense that that's a possibility for them, that they can actually live an impactful life. And everybody ends up being sort of diminished in a sense, because all we see is the glitz and glamour of social media. We see all these great things that other people are doing, and we forget to tell ourselves that, like, hey, maybe I can't do it like this person, but I can still have a very positive impact in my community, to my family members, to my friends. I can still live a very productive life. And I think a big part of that is goal setting. And when you don't have that goal that you're working towards, a reason to get up in the morning, you can have this profound onset of depression. And that's kind of what I feel like happens with Michael Phelps, in this post-Olympic depression. And the same thing with Johnny Manziel. He's working towards this goal his whole life, and that's all he has his eyes on. And the minute he achieves it, it's like there's nothing else for him, right? Like he says, what the hell's next?
Yeah, honestly, that makes me think about kind of just sports in general. Something that I kind of talked about a little during my residency interviews is all these athletes, especially college athletes, like that is more or less like your identity. It takes up so much time. Like for football, it was basically year round. We'd have 6 a.m. practices. We'd maybe get off like 10, 15 minutes before class, do that. We'd have to go lift. We'd have our meetings. We would have our film meetings. We would have all of our classes, especially being kind of in like the bio pre-med track. Like all I did was study. Like my entire life was either football or studying. And I think a lot of athletes, not just football players, once they move on from their sport, which will always happen,
right?
Like either most people aren't going to the major league for whatever, college ends, and you kind of lose a core aspect of yourself. I think a lot of people end up kind of dealing with these issues, like feeling like kind of worthless, having these depressed feelings where you lose that goal of every single day you wake up, even if it's not something you're necessarily excited about when you're getting up at like 4:30, it's still something to strive for every single day. All right. And then college ends, sport's over, and then you have 40 hours each week that you're just like, oh, I don't know what to do with all this free time now. Like I never had this. I don't have like this goal of something that I'm working towards. Like playing, for a lot of people, playing college, whatever sport is like a main goal of theirs, right? Like all throughout high school, like they're probably like the best kid on whatever team at their high school, get to college and they like kind of achieve that goal. And then at some point it's just kind of taken away from them. and most people would still like to play. Like, I'm 27 now. Like, I still think about playing football like most days.
Well, what was that like for you, Andrew? How did your football career end, and what was like the emotional aftermath of that, and how did you deal with it?
So, sometime in like early college, like my freshman year, I had to medical redshirt because I was in the hospital like up until like a week and a half before camp started. So like I made it to camp, but like not enough like time has passed to play. So in my spring, my freshman year, like we have camp or whatever. At that point, I was like starting running back. We had like a couple of guys kind of in the rotation. Fall camp rolls around, and like maybe a week before our first scrimmage, I get like cheap shot in practice. Like have to go through the concussion protocol. So like I kind of come back for like a couple snaps for a scrimmage, immediately get hit in the head again. And I kind of made the decision then. I was like, I either am choosing to kind of go to med school and put more of my time into that, or with football. And I kind of made the decision then where I was like, I'm just going to try just enough to, be on the team, not have to be on scout team. But a lot of my time was going towards getting into med school. So I'd skip meetings sometimes for like research, whatever. My coach was fine with it because he got someone who would go to med school. So probably now when he's recruiting kids, he's like, oh, we had someone go to med school before.
There you go.
So he was like always okay with it. So when it first ended, it wasn't that bad for me because I'd kind of emotionally checked out like 2 or 3 years prior. But maybe like 6 months to a year after, like where the NFL kind of started ramping back up and college football started up again, I was like, wow, like I actually really miss kind of going out there, especially going through like med school, studying for boards. Like I don't think there was a single day where I was like, I would rather spend like 12 hours doing like football related things and being physically exhausted than just like sitting in a chair for the entire day just studying. So like I think as each year goes by, like I miss it more and more. So for me, it wasn't awful with kind of losing that sense of purpose because I had kind of already abandoned that at that point where it was officially over. I think right around when the football season ended was right when I was having kind of the med school interviews, and I kind of had that purpose of like, I want to go to med school, like football's over, like both my knees are killing me, like I barely walk right now, like I'm fine with football being over. But I was able to kind of supplement a different goal where I think a lot of people end up not doing that. Like how many people do you know in college that went, they like, partied a lot, had a fun time in college ends and they're like, oh, what, I have to work the rest of my life? Like it's not necessarily like a goal to have. So for me, I think it was a little easier to transition out of it than I think a lot of people, especially football players, end up kind of dealing with. There's another topic that I wanted to bring up. This is another residency interview topic I brought up a lot, but about, especially with Johnny Manziel and football players in general, how the sport inherently helps mask a lot of psychiatric and mental health issues.
What do you mean?
So, like, football is such a violent sport, right? It requires so much kind of time investment. And I think a lot of things, like you could look at like antisocial, like ADHD, anxiety, bipolar, like things that elevate your mood, even like narcissistic personality disorders, where putting all that energy and effort into something like football, it really is like so physically draining. Like during football, like camp, we'd get up at like 7 and we would have football related activities till 9 p.m. every day for a month straight. So like when you have like this elevated mood for whatever, even like substance induced stuff, you could channel it all towards like football. Like you have lifts every single day, you have practice every single day, like all these meetings. And then when football is kind of taken away from them, they don't have like the coping skills to deal with a lot of these kind of mental health stuff going on. And I think that's when it really starts kind of ramping up. And a lot of people will end up turning to kind of drugs, alcohol, whatever, because they don't really know how to cope with all these extra feelings that they're having.
So is it kind of like a culture of organized sports in the United States that as long as you're performing, a lot of the other stuff you either turn a blind eye to or maybe even encourage to a certain degree? I mean, because we did see that in the Johnny Manziel story, right? He was an amazing player on the field, and like before games, he would go out party, show up drunk, but they're like, hey, like just perform. And if you perform, I think the coaches even talked about being hesitant to confront him about his behavior. So do you think there's some veracity to that kind of perception that as long as you perform, like you whatever, like as long as you're performing, like we're okay with it?
Yeah, no, I think so. I think a lot of people don't necessarily encourage it, but they'll enable it for sure, right? Like with Johnny Manziel, like he's doing all these things that are clearly detrimental. And I feel like I go back and forth on whether like alcohol use disorder and substance use disorder is like psychiatric, because I feel like we can't like, I've heard we can't bill on like ED stuff for substance induced.
Well, yeah.
So it's like, so I kind of put that in with the psychiatric illnesses, just obviously treated a different way. But like I would say, just based on the documentary, it's like clear to be like alcohol use disorder, substance use disorder, bare minimum for like Johnny Manziel, right? And like people are like, yeah, you want to do that? That's fine. Like you don't need help. Like you're performing on the football field. And I think football in particular, with how popular it is in America, you can look at like NFL like viewing numbers. It is insane how much it just dwarfs every other sport. And especially in the South, at like for college and high school, like football for a lot of people is more important than anything else going on in their lives. Like it'll be like grown adults kind of going to the high school football games, and if they win or lose, that'll make or break their weekend.
Well, you're like a god if you're a good high school football player, right? I never knew this, but I grew up in New York City, right? So growing up, like in my high school, I mean, we had a football team, but it wasn't a very big deal. I mean, I haven't been to a single high school football game when I was a student, but I did med school in Arkansas. And boy, in that town, high school football was like something out of a movie, like Friday Night Lights, like for real. I went, there's like cheerleaders, people like marching band. Man, the first time I saw that, I was blown away. It was like straight up out of a movie. I didn't know that was very common actually in places in the South. So that culture, definitely one of
culture
shocks that I had transitioning from a city boy in New York City, trying to integrate into myself into this Fort Smith, Arkansas community. Yeah, that high school football culture really blew me away. So I can kind of see like if you're a successful quarterback, maybe you're also like a little bit good looking, you're in great shape. I can see like how that stuff would get to your ego and kind of influence your behavior and maybe even change the perception that you have of yourself, because there's so much like reinforcement to the self-elevation. And I wonder like what that does for an individual just moving forward. And it's just like we think about these celebrities, right? People that achieve rock star status. We see the same things kind of play out over and over again, unfortunately. Are you guys familiar with the 27 Club?
I'm cheating on this test.
Yes, sir. 27 Club. So it's a cultural phenomenon of musicians, artists, actors, and other celebrities that die at the age of 27. Some notable members include Jimi Hendrix, Brian Jones of the Rolling Stones, Kurt Cobain, and Amy Winehouse. I don't know if you guys are familiar with Mac Miller. He recently passed away recently from an overdose. He was 26.
Philly boy, or no, Pittsburgh boy, I guess, but Pennsylvania boy nonetheless.
Pittsburgh.
So I gotta wait a couple more months before I clear this club, is what you're telling me?
Well, you're not a star.
I'm on this podcast. I feel like being invited to the podcast, I might be a star.
Oh yeah, you might be a podcasting star.
So,
right.
Yeah, that's exactly why we have you on the show today.
I think that's why I got into this program, right? You guys wanted the fame that comes along with it.
100%. So we're almost at 40 minutes here, so I think we should try to like wrap up and give our kind of final thoughts. Kind of going back to what I was saying earlier, like whether the bipolar disorder diagnosis is valid or not valid. I guess what I was looking for a little bit more in this documentary is for Johnny Manziel to talk just more about that human experience. And what I mean by that is like his emotions, his perhaps anxieties, lack of sleep. And I think he did a little bit, so I have to give him credit there. I guess I was just hoping for more. And so I hope that, I enjoyed this documentary. If you haven't checked it out, I would definitely think it's worth your time. And what I hope is that we see more of Johnny Manziel. I was actually listening to an interview today it was with Pat McAfee or whatever. Is that how I say it? Yeah, on ESPN, and they were interviewing Johnny Manziel, and it was actually to promote this documentary. It was released a little bit ago. And they were talking about what he's doing now. And he said he has like various businesses. He's opening up restaurants and all these things, which is cool. And if I'm ever in, College Town, Texas, I'll go eat at your restaurant, Johnny Manziel. But if you're listening to this, I hope that you take it a step further and realize that, I am an individual that I think went through a bipolar disorder. I'll never say I know, but I think I agree with my psychiatrists that have met me before that have also diagnosed me with bipolar. And I have found my way into being a healer, right? I'm now a psychiatrist. And I challenged Johnny Manziel to be like, look, you can actually be maybe a healer as well. I'm not saying you necessarily need to go to medical school or even to therapy school, but like by speaking about more and more about your human experience, like you're going to continue to help so many people. Like the platform that Johnny Manziel has, even though he hasn't played in I don't even know how long. Yeah, I don't know how many years it's been. But how many people could he help if he continues to be more and more open about this experience he had?
Andrew, your final thoughts?
Final thoughts on the documentary. So I'm just gonna. This kind of bothered me in the documentary. So his best friend, who was like the first, like it was like an hour and a half ish.
Helped him with like the autograph stuff, right? Yeah.
His best friend, like the entire first 45 to an hour or whatever, how long the documentary was, like his best friend, they're talking about like all these things that they're doing, and then just randomly just done with the documentary. He's like, yeah, we had like this fight and haven't talked since, and he was just gone. I was just like, how?
There's more to this story.
Yeah, I was like, he was talking more than Johnny Manziel during this entire thing, and then he's just gone out of his existence. So that, and also I feel like they didn't really talk about much after he got drafted. I feel like there was like 15 minutes. It was like, oh, college superstar, like kind of praising him. And then he was like, oh yeah, drugs, alcohol, got out of the NFL in like 10, 15 minutes. I was like, I feel like we could have spent one more time on like what actually happened instead of all these things kind of building him up again.
Maybe there's a part 2 coming one day. Who knows?
Maybe.
All right, I'll kind of give my final thoughts. So I think I enjoyed the documentary. I think I appreciate it whenever these public figures come out and talk about some of the struggles that they've been through, because I think a lot of people, especially in the age of social media, the glitz and glamour, we build up other people like they're impeccable, they're beyond fault. And to see somebody who's reached the heights that Johnny Manziel has come out and talk about how perceptions doesn't really match reality, I think it's a powerful tool to encourage a lot of people that are struggling today to live their lives with more confidence, knowing that it's not just them. We're all in it together. These are human emotions, and to a certain degree, we all go through it, and that's the reason we're able to empathize with one another. I mean, if you've never struggled, there's no way you'd understand what somebody else that's going through a hard time is going through. So I enjoyed it. And with that said, Dr. Andrew Harmon, thank you so much for coming on.
Of course.
Psych Guys Podcast.
There we
out
go.
for this one. See you in the next one.
Like and subscribe. Subscribe. Sound effects.
Mania.
Yeah.